So Master Glenn, as we mentioned, is one of just 8 global pranic healing masters. And he oversees the entire East Coast, all the pranic healers from Maine to Florida, Mongolia, Puerto Rico. Master Glenn has done so much to build the pranic healing community in the US and globally. He created the certification program, and he also created something very near and dear to my heart. During the early days of COVID in early 2020, Delta variant, people were getting very, very sick. Nobody understood what was going on. Master Glenn, along with some other pranic healers, developed a pranic healing protocol to treat COVID. And then he created this system of healing pods. And these pods were groups of pranic healers who would voluntarily work free of charge on COVID patients. He went through the whole mailing list and let everybody know that the healing pods were available to work on them, their friends, and their families. There were almost 70 healing pods in early 2020 that started. Hundreds of pranic healers volunteered. Thousands of patients, COVID patients, received healing through the pods all around the world. And many of those pods, even as COVID subsided and the world kind of returned to normal, continued working. Our Pranic Healing Bucks County Healing Pod is one of those healing pods that continued healing. And there are a number of pranic healers who are part of our pod in the audience here. And that changed so much for so many people. So, Master Glenn, we need to make you a co-host. Sorry about that. For those of you who don't already know Master Glenn, this is really a wonderful opportunity for you to meet him. So here he is.
Thank you, Allison. Thank you all very much. That's a kind introduction, and Allison and I have spoken a little bit the past weekend on this afternoon. Unfortunately, I have an event I'd like to work on. That's why I was busy, but I have time for this. What I wanted to tell the group is that I think the addiction, what we're talking about here, is a disease of, I think they've called it the disease of the pleasures. So it's something that has to be addressed. I think it's a question. It's something that has to be addressed, and I could offer the group a lens of using pranic healing in addiction. But I do understand also that it's really a complex disease wherein the answers people have seen it, and some of you are part of it. It probably lies, according to science, it lies in our brain, in our genes, or just in the world around us. I think we know that for a fact. This, and almost we know from addiction point of view or understanding, those who have been a victim of addiction, is that almost anything deeply enjoyable has the potential to be addictive. One of the things, a similarity between as we approach, which I'm really impressed, because I did a pranic healing work or study before on trying to stop smoking within a couple of months. So if I could stop smoking maybe I could start doing it in other areas. So I doing the stop smoking with Pranic Healing regarding smoking, I looked into AA. So the AA is really fantastic. I was surprised, even for myself, I was surprised that AA has a very spiritual arm and nobody questioned them. Something like that. Okay, let me talk to you about something about what I know about addiction and pranic healing. To introduce to you, some of you have pranic healers in the group. I call it the fastest growing energy healing modality at this point, because we are spread through over 120 countries and active 120 countries. There's not only somebody who's teaching there, 120 countries, they have a center, a pranic healing center, and not only in one city or capital city, but different places. So I would say that this thing has just really expanded so much. What is the basis for pranic healing? We have two principles, which is probably related to your addiction, wherein the body has a innate ability to heal itself. Our body has that ability to heal itself. And what happened was that the second one is based on pranic healing, by providing prana or energy, the healing process is accelerated. This is important in addiction because we understand that people with this addiction, whether it be drug addiction, alcohol addiction, or any kind of addiction, need energy. So pranic healing comes from the word prana, which is life force or energy in Sanskrit. It's founded by Grandmaster Choa Koksui, a Filipino Chinese, and it has really spread throughout the whole world in different religion, different languages, different cultures, even different philosophies. So each one of us come from different facets of society. For some of you, although Allison calls me Master Glenn, I am a physician by trade. I am trained intensive care physician most of my life, but I have been sort of enamored with the philosophical, theosophical world, and I found pranic healing around about 30 years ago, and I myself have used it as in line or parallel to my medical practice. So let's go more to pranic healing. So we looked at energy. This is a no touch, I don't know if it's, you could say no pain, because it's a no touch modality that will work on the energy body. We work on the energy body, while the physicians will work on the physical body, and they have conventional medicine. Our founder says pranic healing is a complementary approach. It's not an alternative approach, meaning that you substitute what your medical treatment is, it adds and complements it. So we work on certain energy centers. So it's related also to addiction, because we have certain energy centers. The most important is will. So we have between our eyebrows, it's what we call the master energy center, wherein it controls the will. Most of the people who have addiction have weak will. That's why they succumb to the addiction, which is actually the lower nature. Lower nature, if you look at it, we have a higher energy centers that are actually related to higher functions. Say, for example, heart is a higher function of love. And from heart, you could go up. Throat, it could be of higher function of expression. And the mind is a higher expression, and so forth. The lower aspect are actually from the solar plexus energy center. It's desire. I hope you got that. It's desire. So you have in addiction, you have to increase the will to control oneself, and you have to disintegrate or control the desire. So the desire depends on different centers. We have sexual addiction. So obviously the problem is in the sexual organs, or energy centers. And somehow we have also a food addiction, which is actually in the gastrointestinal area. And but most of the time it's in the solar plexus wherein we desire. We desire to be a good person, it activates. We desire chocolate, it activates. We desire alcohol, it activates. We desire a good relationship, it activates. So desire, you could even relate this to understanding of the Buddhist. Desire is the actually, if in some Buddhist texts and studies, desire is the root of all our problem. Just think about it. It's a powerful statement, because we desire to become spiritual. Is that is that a problem? We desire good for our children. Is that a problem? So you understand. So what happened was that if you desire, sir, a woman, a man, or a person you want to desire and you don't get it, that's where the problem does. So same thing with addiction. You desire because it's pleasurable. It's not necessarily pleasurable, but by and large, it could be something to damp it. We have a person, I just spoke to her yesterday. She was able to get off, not drugs, but alcoholism. And she passed for years, but she developed cancer and she went into depression and her mother died. So she said, I went back to drinking because I want to dampen the pain of cancer and all that. So I'll tell you something about it. So what happened, people use addiction as a something else. So all of us feel that anything in extreme is not good. So what happened was that addiction is one of them. So it could be, the drug addiction is the most difficult, uh, because it's a very complex area to really even discuss, because it will not only involve the social, it doesn't only involve the government, it involves the legal, it involves the epidemiology or social, it involves also affecting the uh, fabric of who we are or our society, because if our young children or young or teens or youth are affected by drugs, they will be the leaders of the future. Okay, so let's go back. So what happened was that in pranic healing, we have to do pranic healing on most of them. I'll tell you, as I said, I spoke to Allison about this, and I'd like to get your feedback on it. Number one, in different parts of the world, they are also healing, pranic healers are also healing drug addiction. And I was told that the patients come to them, the clients come to them. I will tell you honestly, here in the United States, those who have come to me for healing are actually, you could count them with one hand. I don't know why, but there's a lot. They will come because they want to be healed. There's one person, he came because he was threatened by his aunt, who's a lawyer. You will end up in prison if you don't go to Master Glenn. You will end up in prison, or I'll withdraw your money. Something like, there's a catch there, and he came in for healing. But the rest, the people say, Master Glenn, my daughter is in drugs. Could you heal? My son, my cousin, my nephew, my husband. The patients don't come directly. So I throw it there. So let's review what I've just said. We have pranic healing using for addiction already. The principle is providing energy. They need energy, and at the same time disintegrate the energy or desire to do that. That's one thing. For us to be successful on any modality, you should be able to stop or disintegrate the desire to have that addiction. One. Number two was that I love the AA because they have to go for a higher factor. We need a higher factor. What happened was that when a higher factor is important, that means something above you. We call it what it is. We call it God. But some people do not want to be called it God. I want to call it a higher factor, or it could be a group, or it could be in a partner to help them out. So what happened, you ask for help for another factor because you yourself could not do it. So I think for people who have drug addiction, we have to tell them you cannot do it by yourself. You can do it by yourself, but it's a little difficult. You need a lot of self-confidence, self-belief in oneself, but unfortunately, most of them are not. Then, uh, then the last one I want to mention is one of the teachings of the Lord Buddha. Just because you have already mastered it does not mean you do not go back. Exactly what I said when I said for this person who for 20 years, 30 years did not drink, but when she came into a situation wherein she has to dampen the pain or difficulty, she has to go back to that addiction. So I'm I leave it up to there for the group, and in whatever question that you may have regarding pranic healing, I think I've given you enough nuggets or enough inspiration to show you that it's being actively used in different countries and different places. Thank you.